Coagulation. Exam for review. Absent platelet aggregation in response to bovine von Willebrand factor or human von Willebrand factor plus ristocetin is characteristic of Bernard-Soulier syndrome. GP2B3A adheres to fibrinogen. GP6 adheres to collagen. GP1B95 adheres to von Willebrand factor. The test most likely to be abnormal in a patient that has been taking aspirin is bleeding time. Dolly bodies are associated with May-Heglin anomaly. Under the control of the intrinsic pathway, factor 12 is activated to factor 12A, and factor 11 activates factor 9 to 9A in the presence of calcium. The carrier protein for factor 8 is von Willebrand factor. Platelets do not aggregate in Glanzmann's thrombasthenia when platelets lack GP2B3A. Plasminogen is activated by urokinase, kallikrein, and TPA. Acute ITP occurs in young children, whereas chronic occurs in adults. Acute ITP typically occurs in patients with a history of rubella, rubeola, or chickenpox, whereas chronic ITP occurs in patients who have no prior history. Acute ITP typically shows a platelet count of under 20,000, whereas chronic ITP typically shows a platelet count between 30 and 80,000. Acute ITP occurs within 2 to 6 weeks, whereas chronic ITP can be over months to years. Heparin-induced thrombocytopenia, or HIT, develops 5 to 14 days after heparin therapy. Hemolytic uremic syndrome affects the kidney, whereas thrombotic thrombocytopenic purpura, or TTP, affects neurologic manifestations and the kidney. Hemolytic uremic syndrome occurs in children, whereas TTP occurs in adults. Hemolytic uremic syndrome has symptoms fever, bloody diarrhea, or MHA with schistocytes. Thrombotic thrombocytopenic purpura has the symptoms fever, headaches, visual impairment, coma, and/or MHA with schistocytes. The organelle region is responsible for the metabolic activities of the platelet. Mucosal bleeding is most characteristic of platelet disorder. Specificities of plasma membrane receptors within the peripheral zone are thrombin, glycoprotein 2A, serotonin, and ADP. The characteristics of gray platelet syndrome are thrombocytopenia, bleeding tendencies, and bruisability. The characteristics of Hermansky-Pudlak are albinism and hemorrhagic events. The characteristics of Chiari-Higashi syndrome are albinism and giant lysosomal granules in neutrophils. The characteristics of Wiskott-Aldrich are severe eczema, recurrent infections, immune defects, and thrombocytopenia. Platelet stored products are released through the OCS. The final products of fibrin degradation are D-dimers. Contact group proteins are high molecular weight kininogen, PK, factor 12, and factor 11. A normal platelet count is 150 to 400,000. Plasmin mediates the fibrinolytic system. The best three steps that represent normal hemostasis are vasoconstriction, platelet aggregation, and fibrin formation.